And this fourth video on normalcy, infantilism, and the woke. I would start by saying that the term infantilism has traditionally been reserved for a developmental disorder that involves mainly physical, accompanied by appropriate psychological issues. In psychotherapeutic context, however, infantilism can be seen as a personality organization that is based on infantility. However, the disorder shows all of the traditional criteria attached to the definition of personality disorders: permanence, stability, resistance to change, etc. Therefore, an infantile person, in terms of a disorder, would be a person who, although an adult, behaves like a small child. As I mentioned before, this is a common phenomenon in group psychology associated with toxic ideologies based on identity politics, where their proponents often publicly exhibit features that broadly fall into the definition of a tantrum. These include an inability to tolerate frustration, a consequent unwillingness to accept when the society says no to one's ideas and initiatives, a reduced control of affect, a belief that one ought to be exempted from the ordinary behavioral rules that apply to adults, etc. Interestingly, the process here is one of auto-infantilization rather than being treated condescendingly or disparagingly by society. Infantile persons infantilize themselves. They demand that they be substantively treated like children. However, they simultaneously demand that they are superficially recognized as adults, a familiar dynamics in child psychology. The child requires the benefits of infanthood. However, it demands to be, quote, taken seriously, unquote. Thus, the child will scream, verbally and physically attack the adult when she does not get what she wants. However, she will become angry when adults treat her behavior as childish. Similarly, the infantile person at once behaves like a child and expects to be given all the benefits typically extended to children, such as greater tolerance of temper tantrums, breach or tolerance of breaches of societal rules, absence of legal responsibility for the child's actions, etc. While at the same time the child expects to be formally acknowledged, or the adult person behaving like a child is expecting to be formally acknowledged as a fully developed person. They expect to be addressed with respect, treated with dignity typical of adults, etc. And this type of disorder, when it assumes mass proportions, generates a subculture, an entire subculture, which in itself is potentially psychotic along Lacanian lines. Such a culture first blocks name of the father as the concept of, quote, patriarchy, unquote, that is founded on a hierarchy of competence and on the authority that facilitates any successful socialization. And subsequently, this culture seeks to remove the very concept of name of the father from public psyche by imposing authoritarian cultural counter-norms that typically come down to flagrant violations of freedom of speech and thought. This is the wokeness movement. The current fight between the woke and non-woke political culture in the U.S., exemplified in the pre-presidential election campaign by the Democrats, led by the current President Biden, and the Republicans, with multiple leaders competing for presidential nominations, will determine the overall future of the woke movement and the overall position of the Western culture towards this type of collective psychosis in the Lacanian sense. Now, education is a particularly easy victim to infantilism as a source of psychopathology. Young people, especially children, are vulnerable to the changes in key social norms because they still reside within the trajectory of socialization. And thus the introduction of woke material in school textbooks and curricula, the undermining of basic identities, including the sexual identities with the promotion of transsexuality and surgical alteration of sex, and the militant removal from their vision of society and their relations with others of name of the father as a symbolic reference, mainly the task of radical feminism, in fact. All of this contributes to degrading education, not only in terms of social values and academic quality, but also in terms of the social and psychological health and functionality of those undergoing the educational processes. we currently have a situation where universities advertise for positions with the express proposition that they need to appoint so many black or female or transgender faculty members or those belonging to some other identity group. This is a direct affront to the principle of competence and academic excellence, with direct, obvious, and inevitable long-term effects on the quality and sustainability of university education. And more menacingly, the introduction of texts in primary school textbooks where sexual identity is varied beyond the male and female, such as texts on sexual identity as different from sexual orientation, and hints made to 14-year-old children that should they feel uncomfortable being male or female, they might consider surgical changes to their sex. All of this would have been considered criminal a decade or so ago and would have invited a lengthy prison sentence for anyone who proposed to promote that type of intervention upon the children's socialization and their very conception of themselves. Now, to make this type of policy even more degrading, and to make sure that the humanity in education is even further degraded, it is typically justified, the policy, by the disorder of so-called gender dysphoria, namely one's discomfort with their sexual identity. What is gender dysphoria? As the diagnosis clearly entails, it is a psychological disorder that needs to be treated. It is not a free choice that needs to be addressed by surgery and educational promotion. One does not promote psychosis. In a similar way, one ought not to promote any diagnosis of a mental disorder, including that of gender dysphoria. On a related but separate note, let me say that there is relevant clinical evidence that gender dysphoria is a passing developmental experience where any type of social intervention, especially within schools and peer groups, aiming to suggest to the child to actually question their sex based on such passing sentiments, spells potentially catastrophic consequences for the individual and for society in general. The empirical studies conducted so far, though methodologically they are less than ideal, have found that the transsexual individuals are more psychologically vulnerable, as the prevalence of psychiatric disorders in that population is higher than in the general population. Exerting additional pressure on the already psychologically vulnerable population by inducing normative confusion, and by doing so at the most vulnerable developmental stage, at school age, often amounts to further degrading the mental well-being of the group. The practice of diagnosing gender dysphoria itself comes in the steps of the more traditional perception that some boys and some girls are less boyish and more girlish in their appearance and mannerism, with almost all of those cases changing later in development. However, once sex-altering surgery is offered to minors, regardless of parental consent, the flow of natural development is severed. The ethical, practical, and humane consequences of such policies do not need to be elaborated in detail. The ethical controversies associated with the institutionalization and political articulation of infantilism as a form of personality pathology on individual and group levels, these controversies are pronounced in every aspect of the influence of such infantilization culture. However, they are particularly dramatic in education, specifically because education is traditionally the social and institutional therapy combined with learning within a composite process of socialization and identity formation of children and young adults. In her global bestseller, The Child in You, Stephanie Stahl puts forward a familiar concept in psychotherapy and in education, that the core needs and drives in an adult person resonate childhood experiences in the sense that the adult seeks to compensate by their adult decisions for the losses and inadequacies encountered during childhood. According to Stahl, the models of reactivity in adulthood are directly influenced by the early experiences and extend not only to the general mannerism or sensibility of one's emotional life, but to the specific emotions one experiences and the decisions one makes as an adult. It is easy to imagine if a person who has been neglected as a child tends to develop an emotional overreactivity to situations where their desires or needs are often inadvertently ignored or misinterpreted by other adults? What kind of influence on their later adult life the children suffer from confusing messages sent during their primary schooling, messages concerning their fundamental identity, their sex, and the way in which society looks upon the sexual determinants, the relationship between their sex and their name, the changeability of both, and the related value-laden messages that surround the woke assault on education at present. Education is what offers initial structure to one's overall perception of oneself and the world. Along Lacanian lines, this is at once what offers the best chances for psychological normalcy, both in childhood and in adulthood. If structure is the flesh of mental health, then conversely, the militant assault on value structure and the postmodernist and post-humanist destruction of organically structured identities is at the same time a conceptual and policy assault on mental health. All of these characterizations apply to the woke interventions in education. At present, there is still significant resistance to the tendency to embed education in an amorphous culture of identities. However, forcing the pathological content on early education is a certain way for the woke activists to punch through any remaining resistance and induce a lasting change in the psychological formation of children, with major consequences for the overall mental health of adults. A way to address this ongoing destructive cultural trend is organic education in the fundamental values associated with identity, a continued and quality discussion of the fundamental human identities as men and women, along with the appropriate critical discussion of exceptional situations where transgender identities need to be recognized and accorded appropriate social, cultural, and institutional assistance and support. There's a gaping difference between such care in the context of affirming the authentic identities and a structured educational therapeutic upbringing of children into mentally healthy and well-structured adults on the one hand, and an illegitimate, overwhelming, and conceptually extremely dubious claims to an aggressive intervention into the very substance of identity structure as it is taught in schools on the other hand. It is one thing to continue to ensure an education that is therapeutic and that is organic and that is based on fundamental identities of men and women, whilst recognizing certain exceptions in transgender people, and it is a completely different thing to cancel the hierarchical structure of norms and the concept of what is normal and what is abnormal and declare a complete postmodernist chaos on the values that orient our children in their becoming entangled with the world and in their developing the capacities to handle confusion and various conceptual challenges that they are bound to face throughout their lives.